Hi, my name is Carla Bischoff, and I'm the Director of Market Access for Pacific Northwest and for the Rockies region, and I am an iovera patient. I played 3 sports in high school and 2 in college and really did a number on my knees, and I've been bone on bone for about half of my life. I have tried Synvisc, and on the 3rd round, I reacted terribly and got really nervous to try anything else. And then once I came on Pacira, I started really researching iovera and thought I'd be a great candidate for it. I'm not quite ready for knee replacement. So I had bilateral iovera in September of 22, and it was great. I could walk, I could coach, I could do all the things that I love. It lasted about 6 months to the day, and I was just able to get back to my normal life, which is great. I highly recommend iovera for anybody having chronic knee pain in their knees and maybe just feel like they're not quite ready for knee replacement.
Hi, my name is Eva Seidel-Chodosh, and I'm the Senior Manager of Public Relations at Pacira. A few years ago, after I had my daughter, I started experiencing really painful shoulder pain, which turned out to be frozen shoulder and bursitis and tendinitis in my shoulder. I started doing cortisone shots, which worked for a while, and then I got pregnant last year with my son while I was working at Pacira, and I learned about iovera, obviously. And I didn't want to do cortisone shots while pregnant, so I went to Dr. Gary Schwartz and explored using iovera for my shoulder. And immediately after doing the treatment in April of last year, I had immediate relief. I could lift my arm more than halfway above my head, and I was able to properly rehab my shoulder prior to having my son in June, which allowed me to be able to hold him and do things and carry my daughter, who's now 3.5. So it really has been a game changer for me, and I'm very grateful that I was able to use it while pregnant.
Hi, I'm Jared Ham, and I am a medical science director here at Pacira BioSciences. And as of the past 2 weeks, I am now both an EXPAREL and an iovera patient. So I'm currently sitting here in Paradise in the Dominican Republic, and that is all thanks to both iovera and EXPAREL. I unfortunately broke my collarbone and tore one of the ligaments in my shoulder about 10 days ago, and I realized that I had this vacation coming up and I couldn't miss it. I went to the ER, and all they could give me and all they could offer me was opioids, and I didn't want to be drugged up, and I didn't want to not remember my vacation because of that. So I went to my orthopedic surgeon the following Monday, and they confirmed that I needed surgery. So I knew that at that point in time that I would need to go to Dr. Varichello up in Du Bois, Pennsylvania, to have the motor sparing approach with iovera done on my suprascapular and my axillary nerves. So before I was able to get up there, I was in pain. Laying down was excruciating, and I had to sleep on a recliner. And every time I went down the stairs, I would wince, or if I went over a bump in a car. So after a relatively long drive up there, Dr. Varichello was able to treat me, and it was an immediate relief. At that point in time, I had a much more comfortable drive home, and I was able to lay flat in bed for the first time since I broke my collarbone that night. 2 days later, I did have surgery, and I got an EXPAREL interscaling block. And we all know that iovera and EXPAREL can work in synergy to provide patients relief in the knee, but it can do it in the shoulder as well. So I went through this shoulder surgery and I did not have a single opioid. And I am now 5 days out, and I just got off a plane and am enjoying my life here in the Dominican. So thank you to all of the people that make this possible, and as we continue to expand iovera and EXPAREL to make this more of the norm for patients as they recover from injuries and from surgery. So cheers and thank you.